right, so the last one here is the primary central nervous system lymphoma, and this is associated with Epstein-Barr virus infection. So this particular patient, this is one of the situations where the presentation is very important to look at. They're usually going to be a patient that either has AIDS or poorly controlled HIV, a very low CD4 count. In general, it's an immunocompromised patient. Maybe this patient recently had a transplant, for example, or they're on chemotherapy. These are the patients you want to think about for primary CNS lymphoma. It's not going to be a patient that's completely healthy that just started having seizures. Okay, that's not a classic case. Now, primary CNS lymphoma is usually going to present with this ring-enhancing lesion. Okay, so you can see one right here in this region surrounded potentially by some of this edema. Okay, so this is very classic for primary CNS lymphoma. So it's going to look a little bit different even on imaging from some of the other tumors that we talked about. Okay, and of course they can have some of the non-specific symptoms as well. Now, the origin of these tumors are going to be actually usually from B cells, and the common subtype is going to be diffuse large B-cell lymphoma, and they tend to be very aggressive, similar to your GBM. The lesions can be anywhere throughout the gray and white matter, and again, ring enhancing is very classic on CT. When we're talking about the histologic findings, they're so important. They're so important for these primary brain tumors. But again, this is a situation where the presentation, right, is going to be more important in general, and even some of the imaging findings as opposed to the microscopic, because they're just going to tell you it's atypical lymphoid cells. There's not a specific thing we're looking for, like rosettes or psammoma bodies or something, or fried egg appearance to the cells. We're not looking for any of that. They're just atypical lymphoid cells coming from B cell origin. Now, because it's coming from B cells, we're going to test you on the immuno here. CD20, right? Hands down, this is what I would remember for B cells. Now, there's some other markers as well, CD79A, not nearly in the same league, though, in my opinion, as the high yield rating I put on a CD20 marker. They tell you this thing is staining very heavy for CD20. You want to think about primary CNS lymphoma. Now, the classic association is going to be with Epstein-Barr virus infection. Okay, so also just keep that in mind. This is also particularly important to remember.